Did you know PCOS can start as early as the first menstrual period? Polycystic Ovary Syndrome, or PCOS, is a hormonal condition that strikes a chord in the lives of an estimated 8 to 13% of women during their reproductive years. It's a complex puzzle often discovered piece by piece, a mysterious ailment lurking quietly from adolescence. Dr. Archana Dhawan Bajaj, a noted gynecologist and IVF expert, points out that PCOS frequently begins shortly after a girl experiences her first menstrual cycle. This early onset is pivotal because it underscores a crucial window for observation and potentially early intervention. Yet, despite its commonality, a staggering 70% of women with PCOS go undiagnosed, according to the World Health Organization. This statistic is not just a number, it's a myriad of missed opportunities for early management and treatment. The reasons for this high rate of undiagnosed cases are manifold. PCOS manifests in various forms and intensities, making it a chameleon of sorts in the medical world. Symptoms can be as subtle as irregular periods or as pronounced as significant weight gain, but they often blend into the background noise of adolescent changes, misleading both patients and doctors. Awareness and understanding of these early signs are not just beneficial, they are essential. For those navigating the unpredictable waters of PCOS, recognizing these symptoms can be the first step towards reclaiming control over their health. Recognizing early symptoms is crucial for timely intervention. Imagine waiting years for a diagnosis that could have been addressed much earlier. For many young women, the journey to understanding Polycystic Ovary Syndrome, or PCOS, begins subtly and often confusingly around the time of their first menstrual cycle. PCOS symptoms typically start to appear during puberty, a crucial time of hormonal and physical changes. However, these symptoms might not lead to a diagnosis for 2 to 3 years after a girl's first period. This delay is partly because it can take up to 2 years for menstrual cycles to stabilize and become regular, which makes early signs of PCOS easy to overlook. Moreover, early signs of puberty, such as the development of underarm or pubic hair before the age of 8, could be predictors of PCOS. These indicators, while sometimes considered normal aspects of development, can actually signal hormonal imbalances that characterize this condition. Recognizing these signs early on could prompt a quicker response and management of the syndrome. Understanding this timeline is crucial. The gap between the onset of puberty and the eventual diagnosis of PCOS can be fraught with confusion and misinterpretation. Symptoms like irregular or missed periods, which are common among teenagers, are often dismissed as typical adolescent transitions, rather than potential signs of a more complex hormonal issue. Early signs are often mistaken for normal puberty changes, but they could be clues pointing to PCOS. Dr. Bajaj, what are the earliest indicators of PCOS that young women should not ignore? Well, PCOS presents a spectrum of symptoms, and their manifestation can vary significantly from one individual to another. This variability often leads to delays in diagnosis. Some young women may experience very mild signs, while others face more severe symptoms, complicating early detection. One of the key symptoms to be vigilant about is irregular periods. This is often one of the first red flags. A young woman might notice that her periods are not only irregular but may also be scanty or excessively heavy. It's crucial to track menstrual cycles, especially after the onset of puberty, as this can provide early clues to potential hormonal imbalances. Another significant symptom is hirsutism, or excessive body hair, which can appear on the chest, stomach, and back. This occurs due to elevated levels of androgens, which are typically male hormones that women with PCOS often have in higher amounts. Abdominal weight gain is also commonly associated with PCOS. This isn't just about aesthetics, it's a health concern, as it can lead to other complications like insulin resistance, which is prevalent among PCOS sufferers. It's important to remember that these symptoms alone can't confirm PCOS. They could be indicative of other health issues as well. Therefore, regular checkups are essential. During these visits, discussing any changes in your body or menstrual cycle with your healthcare provider can help catch early signs. Understanding potential risk factors, such as family history of PCOS or early puberty signs, also plays a critical role in timely diagnosis and management. Furthermore, I cannot stress enough the importance of not dismissing these symptoms, especially in their early stages. Early intervention can significantly ease the management of the condition and improve the quality of life. Awareness and understanding are your best defenses against PCOS. Why is diagnosing PCOS so challenging? Well, let's delve into the intricacies that make this condition a bit of a medical conundrum. Polycystic Ovary Syndrome, or PCOS, is not only widespread but also notoriously elusive in its early stages, often leading to delayed diagnoses. One of the primary reasons for this delay is the sheer variability of symptoms. PCOS can manifest in numerous ways, ranging from irregular menstrual cycles to more severe signs like hirsutism and acne. This symptom diversity not only confounds those experiencing them, but also challenges medical professionals trying to pin down a definitive diagnosis. Further complicating matters, as noted by Dr. Archana Dhawan Bajaj, is that PCOS can sometimes be completely asymptomatic. That's right, no signs at all. This silent progression means that PCOS might not even be on the radar until more serious issues, such as infertility, bring it into focus. This lack of symptoms leads to underdiagnosis and, unfortunately, missed opportunities for early intervention. This brings us to the critical role of healthcare professionals. Recognizing the potential for such a wide range of symptoms and the possibility of no symptoms requires a high degree of vigilance and expertise. Regular checkups and a thorough understanding of the patient's medical and family history are paramount. Doctors need to be detectives, piecing together clues that might initially seem unrelated but could point towards PCOS. Getting a diagnosis can be a journey, but starting it early is key. While there's no cure for PCOS, managing it effectively is entirely possible. The key to managing polycystic ovary syndrome, especially in young women, lies in a combination of lifestyle adjustments and appropriate medication, guided by healthcare professionals. Firstly, let's talk about lifestyle adjustments. Maintaining a healthy weight is crucial. This doesn't mean striving for an unrealistic body image, but finding a weight that feels healthy and sustainable for your body. Regular exercise plays a significant role here. It's not just about hitting the gym. Activities like walking, cycling, or even dancing can help manage symptoms by improving insulin resistance and promoting hormonal balance. Moving on to diet, it's important to focus on eating whole, unprocessed foods. Think fruits, vegetables, lean proteins, and whole grains. These foods can help manage insulin levels, a common issue in PCOS. It's also helpful to reduce intake of processed foods and sugars, which can spike insulin levels and exacerbate symptoms. Now, let's delve into the role of medications in managing PCOS. Birth control pills are often prescribed and can be quite effective. They help regulate menstrual cycles, reduce acne, and manage excessive hair growth by regulating hormones. However, it's vital to consult with a healthcare provider to find the right type and dosage. Anti-androgens are another class of medications that might be recommended. These can help reduce unwanted hair growth and acne by blocking the effects of androgens, which are typically high in PCOS. Metformin, originally used to treat diabetes, is also used in managing PCOS. It works by improving the body's sensitivity to insulin, which can help regulate menstrual cycles and even aid in weight management. Dr. Archana Dhawan Bajaj emphasizes the importance of a personalized treatment plan. Each individual's experience with PCOS can vary, so treatments that work well for one person might not be as effective for another. Regular checkups and open communication with your healthcare provider can lead to adjustments in your management plan as needed. Effective management starts with the right knowledge and actions. By understanding the tools available and working closely with healthcare professionals, young women can lead healthy, fulfilling lives despite PCOS. Let's take control and spread the word about PCOS. Polycystic ovary syndrome isn't just a personal health issue, it's a community concern that thrives in silence. If you or someone you know is experiencing symptoms like irregular periods, unusual hair growth, or persistent acne, it might be more than just a minor annoyance. These could be signals from your body, urging you to seek advice from healthcare professionals. It's essential not just to listen, but to act. The journey towards understanding and managing PCOS begins with awareness. By talking openly about these symptoms, you help break down the barriers of misunderstanding and stigma that surround this condition. Remember, recognizing the signs early can lead to timely and effective management. Moreover, this isn't just about individual action. Share your knowledge and experiences. Whether it's through social media, a blog, or just chatting with friends, Every conversation can light a spark of awareness. Discussing PCOS openly increases its visibility, which can encourage others to seek help sooner. For those looking for more information or support, there are numerous resources available online. From detailed articles to support groups and expert advice, these resources can provide guidance and reassurance to those affected by PCOS. Engaging with these materials can equip you with the knowledge to ask the right questions and find the most effective treatments. Your voice can make a difference. Share this video to help others recognize and manage PCOS.